So I'm really delighted to be able to focus on this important transition that we've made to really think about the workforce that we support across England, Wales, Scotland, Northern Ireland, across the United Kingdom. And it's really critical to think about everybody in our workforce needs support and needs to be sustained. But tonight we're really going to focus in on international midwives who are either in the process of joining our UK midwifery workforce or have already transitioned and are settling into life, joining our workforce. And we wanted to start by saying a huge thank you. I'd like to extend our gratitude to all of those midwives that have made that big decision to leave their home and sometimes their family and their children in some circumstances to come and support us and our families here in the UK and our workforce here and our services across the United Kingdom. We are so grateful that you are sharing your expertise, and we are also super grateful to everybody involved in supporting you to make those transitions. From the national team and the work they've done to strengthen processes and systems to make this supported and as easy as possible, from all the learning that's gone on in regional teams, local system teams and local maternity unit teams, and all the hard work that's been going on locally in maternity and perinatal services to really welcome new colleagues from all different countries around the world. And we're going to hear a little bit more about that soon and shortly. But we just wanted to start with a huge amount of thank yous and gratitude. We want to also acknowledge that, you know, we are part of a global community of midwives, and together midwives transform outcomes. Midwifery, quality midwifery care improves over 56 evidence-based outcomes for families, for women and babies. And we know that's been captured really well in the Lancet Midwifery series and in other Cochrane reviews, such as James Sandell's work. We know that midwives are set and positioned to help families not only survive, but to thrive and transform in their lives. And we can make a difference to those physical outcomes and then also impact on positive experiences and perceptions of care and care provision, but we can also influence public health. So it's really important that we invest in our midwifery workforce, both here in the United Kingdom and obviously all around the world. Yet we know from the State of the World's Midwifery report, the latest edition was in 2021, that there is still huge gaps around midwifery and the numbers of midwives and regulated, registered and appropriately educated midwives around the world. And we do need 900,000 more midwives. And in the United Kingdom, we also have a deficit in our workforce, and working really hard, and the national and regional and local workforce teams are working really hard to address that collectively with education organisations to really come together to try and address those issues. But all of the international recruitment activity in the United Kingdom had to be set in an ethical framework to make sure that we acknowledged that wider need of midwives around the world. And so all of that recruitment activity was done really carefully with the World Health Organization and international bodies to ensure that any recruitment was done in an ethical approach. And obviously, because midwifery can vary and the context of midwifery practice can vary around the world, it was done really carefully to ensure equivalence of expertise, training, education and experience. But equally, we have a really strong range of quality standards and frameworks that international midwives have to achieve when they come to join the UK maternity workforce. And that's governed by the Nursing and Midwifery Council. And it does mean that midwives that are joining our workforce from any other country from around the world do have to go through what I consider to be quite a significant journey. with lots of hurdles and steps along the way for them to overcome and achieve, lots of moments of assessment from the recruitment stages all the way through to accessing visas, gaining, travel support, all the way through to the NMC test of competence, passing those assessments, English language testing, and then obviously being suitable for local practice. So there's a lot that midwives are having to face, and many of the midwives joining our workforce are very experienced, expert, specialist midwives working in their own country. Have got lots to bring to the UK workforce, but still have to demonstrate that they can meet the standards of proficiency. And so I just wanted to start the session this evening reminding us of the importance of offering support to those midwives, because professionally they've got a gauntlet to get through, but personally, what a massive step to come away from your own culture, your own environments where you're comfortable with your family support networks, and then to enter a new country and to settle into life outside of work as well. And we know how important it is for us to be, supported well, not just professionally, but personally. I'd like to take a moment to just acknowledge that there's so many people working to support and help international midwives to settle and to feel support. We've got the Association of South Asian Midwives doing lots of work to help, and also the Society of African and Caribbean Midwives, just to name a couple of those wider societies that are there to reach out. So if you're an international midwife watching this, maybe you could reach out to those organisations alongside us at All for Maternity, and obviously connecting with the Midwifery Maternity Forum, Matflix, and also the Midwifery Hour that you're engaging with now. But there's a wide range of resources there to support you, and it's really important to acknowledge those people that are doing great work to help. We also recognise that as you transition into life here in the UK, or if you're supporting midwives that are transitioning to life in the UK and professional working careers as midwives in the UK workforce, we wanted to put together a webinar series at All for Maternity that you could access. So we've developed a webinar series, myself and Neesha and the team at All for Maternity, to create a 4-part series that will support you to really survive and thrive during your career as a midwife in the UK. So we've created a special resource that will help to give you support, facilitated by a range of leaders that can give you really good support around your clinical knowledge and awareness of midwifery in the UK. So myself and Neesha are both midwives here in the UK and have worked across education, practice, research and leadership. But then we're also going to be joined on the programme by Aaron Turner, who you're going to meet later this evening. And collectively, we're going to provide a programme that not only supports your learning needs, gives you an opportunity to explore your experiences in an interactive way, but you're also going to get an opportunity to be supported with your ongoing well-being needs, thinking about you, your self-care, and how you can sustain yourself and thrive in your experiences and throughout your career. So really the webinar series is here to support you to kind of feel good about your work and to enjoy being a midwife here in the UK, to give you a real focus on your career as a midwife, but then also to give you that pastoral support as well. So there's going to be 4 sessions that you can get engaged with, looking at different contexts over a 4-part series. And it's going to be accompanied by free learning and support resources. So we're really delighted that you'll get interactive ebooks that are free. You'll get resources to make notes. You'll get a certificate, and you're going to get free access to Aaron's One Thought programme so that you can access meaningful wellbeing support, which is really exciting that we can give all of these free resources to you. We want to make sure that you have access to the recordings, whether you can join live for the webinars or not. You can still make use of the resource because everything will be recorded. You'll be able to read ebook chapters and make notes. And you'll also be able to make notes when you watch any of the recordings. And we have an interactive space where you can ask questions of the presenters and of each other and create a bit of a community feel. So if you're really interested in taking part, you can use the QR code and you can register via Eventbrite. It's only £15 for international midwives to join, or anyone that's supporting international midwives would benefit from accessing the webinar as well. So anyone involved in workforce retention or practice development midwives, or others preceptors that are working closely to support international midwives locally at unit level all the way through to system and regional levels. So we really invite you warmly to join us.